Facilitated movements are undertaken to help ease spasms and spasticity and reduce the possibility of stiffness developing into loss of range of movement. They can help maintain freedom of movement, good movement patterning and comfort. Facilitated movements alone will not prevent or improve loss of range of movement. Contractures will form if long periods are spent each day in one position. Facilitated movements are most easily completed in lying, with the bed as flat as comfortable. Movements may be repeated until they feel free, slowly and gently, not pushing into strong resistance. A stretch sensation might be felt, but the movement should not be continued into any pain. Patients may be able to join in with some of the movements and should be encouraged to do so, without making so much effort that spasms are increased. The height of the bed is important to prevent strain. About hip height is a good place to start. If it's necessary to reach too far, move them closer to the side. If spasms are strong, positioning the legs in a frogged position might help reduce them to allow easier facilitated movements. Generally, spasms and spasticity are eased most effectively by rotational movements, starting with the most central joints. Once settled, it's easier to access good movement. So begin by freeing up the shoulder blades. Grasp high into the armpit and support the shoulder blade. It is absolutely essential to avoid pulling on the arm and separating the shoulder joint. This will cause pain and potentially harm. The movement should be generated by the hand on the shoulder blade, moving it up and down. Then forwards and back, emphasizing the downwards and backwards movements as they are more prone to stiffness. Moving on to the shoulder itself. Again, spasms are often relieved by rotation. So start with the elbow on the bed, bringing the hand in and out, rotating the shoulder. Do the first movements with relaxed arms, fully assisted. Then, where possible, move on to doing them together to exercise the rotator cuff. Place a folded towel or sheet under the elbow so it's level with the shoulder. Repeat the movement with the arms a bit further out to the side. Once feeling free, move on to lifting the arm above the head. This is the movement which is most likely to be painful, typically a pinching pain in the shoulder itself and possibly down the arm. This pain absolutely must not be pushed through, and if it cannot be eliminated, stop. Support under the shoulder blade and make sure it is coming round as the arm moves. Make sure the arm is snug and well supported. Once reaching 90 degrees, you will need to change position. Once moving freely, if it's possible without pain, do some reaching to the ceiling together to encourage activity in the serratus anterior muscle. Again, make sure the movement is coming from the shoulder blade. Do not ever pull the arm, so support under the shoulder blade where necessary. In this position, where possible, tricep stretching and strengthening can be done. Then, reaching above the head, if this can be achieved without pain, bending the elbow if possible. Slowly return the arm to the bed. Pain is more likely on the way back down, so support the arm as much as necessary to keep the movement comfortable. Movements of the shoulder can be particularly hard to do well and can cause harm when done badly. If you are at all unsure, get advice from a physiotherapist. Once you've returned the arm to the bed, stretch the front of the elbow with the palm face up. Then palm down, moving the stretch into the forearm. Pause at the end of each movement if they feel stiff. Wrist and hand facilitated movements are best carried out in sitting, so the individual can see the movements and, if able, participate. Caution must be taken not to overstretch any joints, but particularly the wrist and base of the thumb, which are prone to subluxation. When carrying out facilitated movements of the wrist, rest the forearm on a suitable surface. Use one hand to stabilise below the wrist, whilst using the other to move the wrist smoothly through flexion and extension, changing direction at the end of range. If the individual is likely to use a tenodesis grasp release in the future, ensure the fingers are bent when straightening the wrist and straight when bending the wrist to prevent overstretching of the soft tissue, which requires shortening. Radial and ulnar deviation facilitated movements can also be carried out if appropriate to the individual's level and completeness of injury. Again, caution is required to ensure soft tissues are not overstretched, maintaining passive resistance of tendons and ligaments. Every joint of the fingers and thumb should be moved individually to optimize cortical representation in the brain, maximizing the potential for improvement. When carrying out facilitated movements to the fingers and thumb joints, Each joint must be stabilised proximally before movements are carried out. Do not straighten any joint beyond neutral extension and ensure this does not happen to proximal joints when moving distal joints. Once individual joints have been moved, the fingers can also be moved through flexion and extension together. Please note these movements should be pain-free and not cause any other symptoms like swelling, heat or redness. If this is not the case, they should be stopped and advice sought. Specific recommendations with regard to facilitated movements are given as patients leave the London Spinal Cord Injury Centre in the carer handbook, and these should be followed. These movements should be done by someone competent to do so. Training for upper limb passive movements is provided to carers. If the recommended programme no longer seems appropriate, please request a review from the physiotherapy team.